COVID-19 Directors Livestream with HHD staff. We deeply appreciate the hard work that the HHD staff is doing for the City of Houston. This 1-hour live stream entails updates and what the Houston Health Department is doing as it pertains to the COVID-19 pandemic response. I, Dr. Melissa Shelton, will be moderating the live stream. Please note, after the updates, we will open with questions and answers from the staff. If you would like to ask a question, please select the My Question tab located at the top right. You'll be able to write and post your questions. This is just a friendly reminder that there will be a 10 to 20 second response delay on the web. With that ado, I want to welcome Kirsten Short, our HHD Epidemiologist Bureau Chief.
Good morning, everyone. Thank you for tuning in. And I want to thank Stephen for the opportunity to speak to you guys all today. What they've asked me to do is talk a little bit about what the team in epidemiology is doing here. So for those of you who haven't heard me speak before, and you might say, what's an epidemiologist? We generally call ourselves sort of the disease detectives of the world. So in sort of routine times, we're taking those things that get reported in, whether it's an outbreak of vomiting and diarrhea at a wedding, or whether it's a case of measles, and we're doing that investigation to find out who else might have been exposed, how they might have gotten sick, and what things can happen to prevent others from getting sick and to help them to get well. We also take that information and share it up to our partners at the state, our partners at the CDC, so that if we need to change sort of bigger guidance across the way that we can do those things. So obviously, we've been quite busy over the past several months going on. And I do want to take this opportunity real quick for any members of our team in epidemiology that are tuning in to really give you a heartfelt thanks. You guys have been working on the front lines of this tirelessly, 7 days a week, 24 hours a day, working on this. And I just want you to know that I appreciate this, the director appreciates this, and we all appreciate this. So some of the things that we're doing, as I say, working 24 hours a day, is we get these reports that are coming in of people who have tested positive for COVID-19. And as this has moved along, we've been getting more and more reports that are coming in. You've been seeing those numbers go up both here in Houston, across Texas, across the nation. And what we're doing is looking to investigate those as best we can. So when we get those reports, they're assigned out to someone to do an investigation, and they reach out either to the hospital or the medical provider, if the person might be in the hospital, or they try to reach out at home and talk to that person directly to find out where were they in the time when their symptoms started and a day or two before that. Make sure that if they're at home, they're staying home. Give them some education about how they can keep their family safe, right? So if you're a COVID-19 positive person and you're at home, one of the things that we really want to talk with you about is staying away from the rest of those family members or those people that are living in your household, right? So ideally you stay in your own bedroom and you just live there. If you have your own bathroom that you can dedicate to yourself as that sick person, that's best. And then people can come and maybe, bring a little food outside your door. They can step away, you can open your door, take your food, eat it up, put those dirty dishes back out when you're done. And then those dirty dishes can hopefully go straight into the dishwasher. So you're really trying to limit your space around those other people in your household. So if you don't have a plan for that in your family, really think about how you can make that work. And then, like I said, the other things that we're doing is trying to find out what we call close contacts. So there are different levels of contacts. So the people that are at the highest risk or have the greatest chance of also becoming infected are those that I just talked about, those household contacts or your intimate partner contacts, those people that you really spend the most time with and spend the most time around. The next level that we would be concerned about are those that are called close contacts. And so those are people that are spending greater than 10 minutes within 6 feet of somebody. And so that's how we're sort of limiting and scoping that out, and that's based on CDC's guidance. They actually say it's like 10 to 30 minutes, but we're being on the cautious side and leaning towards that 10 minutes on that side. So folks that are identified as close contacts, what should they do? Well, once you've been identified, you should also be going home and doing what we call quarantine staying home for 14 days. That's the length of time that it might take for somebody to develop symptoms after that last time that they were exposed to that person. So if you were exposed to somebody on Monday and you got the call on Tuesday or Wednesday to go home, you would start counting your 14 days from that Monday, and then would go 2 weeks after that before you could come back out. When you're at home, you should be doing the same thing that person with the illness is. You should be isolating yourself inside of your home from the other household members that you have. Again, because should you develop symptoms, you want to minimize the chance that you're going to pass them on to those people in your household. So again, stay in that own bedroom, ideally with an own bathroom. Try not to come out. If you need to have, grocery delivery or things like that, it's okay for people to drop those off at the front door, ring the doorbell or text you, and then you can, after they step back, you can come on out and get those and move on. But don't have them come into your house. We really want to minimize that risk. So you stay home for 14 days and you monitor yourself for symptoms. What you're really looking for in terms of symptoms is you're looking for developing a fever. You're looking for that cough. You're looking for that shortness of breath. The other thing that we've heard sort of anecdotally, you may have also heard in the news, is some people are also reporting sort of a loss or diminished sense of smell or taste, but that's not across the board. Also, some people have been getting diarrhea, but again, that's not everybody, that's just some. So generally you can stay home and monitor your symptoms on that side. If you get any sort of symptoms that you might need, what we call emergency symptoms, where you might need some additional care, that would be if you're having trouble breathing, if your lips are starting to turn blue, if you're having seizures, if you're sort of getting altered consciousness, then we absolutely want you to go ahead and seek emergency medical services. The most important thing at that point, though, would be to go ahead and let that person who's taking you and let that provider know, hey, I've been exposed to somebody with COVID-19, so that those healthcare workers can take those steps that they need to take to protect themselves as well. But for the majority of the contacts that we do monitor and that we have been monitoring, they go through that 14 window period and they don't develop any symptoms. And then they can come back out and go back and resume sort of their regular life activities as they're going through. And then, so that was that medium risk. And then what we're also talking about is what we call sort of low risk. And that would just be anybody on the street. So if you're just walking by someone, the chance that you're actually going to contract COVID-19 from that person right there in that time is really small. We can't say that it's zero. We can't take this risk down to zero, but we can say that it's really small. And so those folks, we don't actively monitor those. We really try and focus those activities on these medium risk and then this high risk sort of household contacts. So, Melissa, I do see that Stephen has arrived. So if we want to switch over.
So what we're going to do right now, thank you, Kirsten. We're going to ask a couple questions. We do have a couple that are posted.
Okay.
So one of the first questions are we able to get more masks such as N95 for us and our families? That's the first question. Good morning, everybody. I'd like to also welcome our director, Stephen Williams.
Good morning. How y'all doing? Very good question. Kirsten, you don't really have to wear N95 masks in public. Those are really preserved for healthcare workers. The recommendation, and that was one of the things I was going to talk to you about today, is that when you're going out in public and you know you're going to be around people, say in grocery stores and pharmacies, to wear cloth face coverings, or if you have a mask, you can do that. I think but the main recommendation is to try to avoid, close contact with people. We're still stressing social distancing is number one, and good hygiene. We do have some masks available for health department employees. I'm not making it totally mandatory, because if I did that, that means that I'd have to give you a mask, but we're making it available for folks who want to wear them. We have enough supply for everybody in the department that really wants to wear. Well, we ordered some last week, and we have some coming in tomorrow. So go ahead and wear them when you know that you're going to be in groups of people.
Even a follow-up question to that is, will the city provide masks to the public for free?
highly unlikely. Reason is that we don't really have the resources to do that. As you know, the reality is that we are taking tremendous financial hit because revenue is not really coming into the sales tax is certainly down, which is one of the ways that the city brings in revenue. And I suspect in the upcoming weeks that we're going to be looking at how we actually slow down our spending. Don't know exactly what that's going to look like, but no, there are community drives to collect masks for people that healthcare workers. I think that is going on sometime this week, and the reason for that is, and that's why I'm not suggesting that we go out and try to acquire N95s, is because they're in high demand. A number of healthcare institutions have been paying attention to the news, been talking about not being able to access the personal protection equipment that they need.
The next question is, this might be for you, Kirsten, where are HHD and county getting their COVID numbers from?
So we get reports from a number of different sources. So we get reports that are coming in from the hospitals that are doing tests themselves. Our City of Houston laboratory is doing tests, not just for City of Houston, but they actually support 17 counties in the region. So those tests are also coming in. There are private and commercial labs. You may have heard of Quest and LabCorp, some of the big names that are in the news, as well as there are a lot of others that are also in the news. And so we're getting positive test results from a number of different sources, and they come into our health department, to the state health department, and to the other county health departments across the state.
My next question is actually more of a statement. There are several staff members that were exposed to a staff member who was confirmed positive. Their names were given to EPI, but these staff members were never notified of an exposure or called for quarantine. What is the next steps when an incident like this happens?
So when somebody is notified as positive, our ability to take that action is predicated on us being able to get that positive lab report. So sometimes those lab reports coming into us are delayed. And so what we've been encouraging employees to do is, if you get a positive test result, please go ahead and let your supervisor know. Your supervisor can then work with the epidemiology team and the employee health team as needed. And then if you are identified as in that medium risk group, in other words, that's 6 feet for 10 minutes or more during the time when that person was infectious, then either your supervisor or someone from epidemiology or employee health will be following up with you to let you know about that. And then those folks have been notified and asked to go home.
Now, for example, I had two situations related to that. Oftentimes, EPI is not necessarily getting the test results. I had a situation where actually an elected official called me and said, "Stephen, I got tested, more than a week ago, and I don't have my test results. But my wife tested at the same time. She worked at a healthcare or related facility. She tested positive." And what I told him is just assume you're positive and really just take the measures and the steps that Kirsten had talked about earlier, because oftentimes the tests are delayed, sometimes up to 2 weeks. Another situation, had a healthcare provider call me and said that she was in contact with a person that was positive, but it was on the 18th. And I said, the 18th was more than 2 weeks ago. If you're not really developing symptoms, 9 times out of 10, you're probably okay, but it's up to you as to what you do. I want to express my appreciation to Kirsten and the EPIs, because these are folks that are, you don't see on a daily basis. They're, I guess, hidden in their offices on the floor and other places. And I know that they've been working extra hard, trying to do these case contacts. I touched base with a friend of mine, actually a colleague called me from Fort Worth. The elected officials were putting pressure on him because he was behind. I think they had Kirsten about 400 cases or something like that, and they had only gotten to about half of them. That's why I asked you the question last week. And I said, you're doing good. We had 500 cases, and I think we got about a third of those. And it really, if there's one contact, you might have a half dozen or a couple of dozen people that you follow up with, and all of that takes time. So my hat's off to the EPIs that are, our invisible protectors.
Do people age 69 and older stay home, or can they go to work?
I think you have to make that decision yourself. I mean, if you're working in an office and you're able to social distance, I think that it is okay to go to work. If you have underlying health conditions and they're serious, I think you have to determine what level of risk you're willing to take. I don't know that I would draw a hard and fast rule about people that are a certain age, and whether or not they should come to work. And that personally, I tease about this. I'm in, from an age standpoint, I'm kind of in that at-risk category, and I don't know that I can not come to work. I think you would frown on that, me not coming to work just because I was over 60 years old.
This has to do with hazard pay, which I know everybody doesn't like using that word, but the question is, will employees not working from home get hazard pay?
You know what? I started to say something. I had this real reaction to that because I feel real strongly about this. And I was talking to somebody last night about it. I have pictures on my phone where I have people suited up that are out there, really packaging specimens to ship off. I have folks, when you go out to Butler or to Delmar, I have folks that are really screening people. They're the first people that you come in contact with. They're not totally suited up, and we're maintaining 6 feet distancing. They're doing that. If you go on the 4th floor, I was here Saturday and Sunday. I had both executive staff and non-executive staff sitting around that table trying to, follow the numbers, responding to questions. I have people that are working in the clinics although we've, kind of pared that down to the extent possible, that are still continuing their work. I have WIC workers that are continuing to do that work. Some from home, we're trying to minimize that. How can I, look those folks in the face and say, I'm going to pay the person, that's sitting at home not doing any work, while I'm expecting you to do this? The answer to that is no. If you're at home, you're not, doing any work-related work, no, you will not get paid. Use your own time or whatever. I have to remind people you're a public health employee. I don't really want any fair weather public health employees. Personally, last week I was looking at Kirsten and she showed me pictures of the kids that she had spent a whole lot of time with, and we were encouraging her to go home one day because, we want her to maintain, a good relationship with her kids. And I know how that is, And so if I'm expecting her to do that, certainly I can't reward people for not showing up for the game, for not being in this battle against COVID. I have executives, I have rank and file staff that are proud to do that. I understand people's fear, and you can tell I'm a little bit emotional about that, but I've always said that as health department employees, we show up and we show out. We get the job done. And I'm so grateful for the 90-something% of my employees that really show up and get the job done. If you're only here to work during good times, to me, you're really not taking seriously the public's trust. The public is counting on us to do our job and to really, in this case, save lives. That's what this is about, saving lives. Sorry for going off on that, but the answer is obvious.
Kirsten, this might be more for you. If you cannot quarantine fully due to taking care of a child, what is your best suggestion to protect your children?
So that's an interesting question, and that's something that we've struggled with inside of our home as well. Stephen mentioned I have a couple of kids, and my husband is really the primary parent at this point, but we've talked about that. So should one of us get sick or need to quarantine, we do have 2 adults in the household. I recognize not everybody does. And so our plan is for one person to sort of lock themselves in the bedroom, as I kind of talked about, and the other person takes on even more responsibilities than they already have, maintaining that. We've also talked about if one of our children gets sick, and we've had this conversation with my kids so that they know and are prepared in case we need to put this plan forward. We would take that sick child, and one parent would lock themselves in the bedroom with that sick child, basically, and the other parent would take care of the child that wasn't sick at that point. The goal being, should both parents in the household become infected and develop symptoms, that we can stagger that out. That's the goal. If you are a single parent and so you can't lock yourself in your bedroom, it depends on the age of your children. Some mine are elementary school age. So especially my 5-year-old, she just can't do a whole lot of things by herself at this point. She's not that independent. If your children are older and can be a little more independent, you can do that a little bit better. So some of the things that they recommend at CDC is that if you can wear masks, like we've talked about, you can wear masks to sort of prevent that spread going through. You can also wear gloves if you've got them available. And then again, it comes back to, as much as possible, maintaining that social distance, so limiting that interaction. I know it's hard when you've got those littles that really want to come and get that reassurance from those snugs and those hugs and those snuggles as far as that goes. So that's going to be a really tough piece for any family to work through. But that social distancing as much as you possibly can. And then cleaning those surfaces that you have. You know, we talk about hand sanitizer and Clorox wipes, but you can also use diluted bleach. So there's a dilution ratio on CDC's website. So you can make up some diluted bleach and you can use that to wipe down those high touch surfaces if you're the adult and you're in quarantine, after you go through. So when that kid has to go through, if you do have to share a bathroom, they can come in after you clean that out. So those are some of the steps that you can take to sort of minimize that risk.
Thank you. There's another question pertaining to the mask. An individual was provided a mask last week, and they stated that a protective foam came off the mask. Maybe they're thinking that mask might have been old. Are those masks safe to use, and are those expired PPE?
Can you distinguish whether or not you're talking about a N95 mask or a surgical mask?
They actually didn't distinguish that. They said last week I was provided some masks, particular masks, and had a protective foam that came off of it. It might be.
I'm assuming that you're talking about N95. I was made aware of the fact that some of the older N95 masks, that foam on the inside will come off once you start sweating. Shay and I actually had a conversation with them. That is why we, a couple of weeks ago, purchased new N95 masks. Our goal really is to purchase different sizes and brands of N95 masks, because all masks are not the same, all on our face are not the same shape or the same size. When I thought about getting fitted for an N95 mask, they told me I had to cut off my beard. And as you know, I still have on my beard since I haven't shaved this thing off except one time since 1975. So I'm hoping that I won't get in a situation to where I have to use one. But I do, and we started this weekend using these masks. I've seen some that were yellow. We have these blue masks. And when you know that you're going to be, in a work situation or around folks, and social distancing is kind of challenging, I would encourage you to just go ahead and put it on to protect everybody that's around. This, y'all, is not a device that is going to protect you from getting COVID. It is about protecting those other folks. Still asking that you social distance and you use good hygiene.
Next question is, people that work the 7:30 shift and up are being tested for fever. But what about the group that comes in at 6 a.m. and 7 a.m.?
What am I supposed to say about?
I talked to some of them, they need to go back downstairs by 7 o'clock.
We're asking those individuals to go downstairs at 7 o'clock to get their temperature taken. And as you can see, even I have my temperature taken. And I get a little bit nervous about that. So I have this thermometer in my car. So before I get to work, I take my temperature so I'll know what my temperature is going to be when I'm walking in the door. And I'm telling y'all that because to just acknowledge that there is a level of anxiety amongst all of us about this deal. But you know, it's better to be safe. It really is.
The next one is Scott's email this morning says, after the employee tests positive and the workspace has been vacated for 24 hours, the workspace will be deeply cleaned. But the employee's test results do not come until 7 to 10 days after a test. So the area has already been vacated for 7 to 10 days. Does that area still need to be deeply cleaned?
It probably still needs to be sanitized, yeah. That's what I've been recommending. Even though, you know, the first step has been done because nobody's been in there or whatever, but I would suggest fine for that. But, you know, this COVID-19 there are a lot of unknowns about it. You know, there have been studies about how long droplets stay infectious once they're on certain kinds of material. So it has to go ahead and wipe it down. And I encourage you, I mean, you will see, you know, to have some wipes and just wipe surfaces around them. I found myself doing that with my steering wheel and that little button that you press to make the car come on and everything. And kind of laugh at myself, to be honest, sometimes. But if I go out to store something, I certainly do that when I come back to my car.
Will restaurants and food service workers be encouraged to wear masks?
Now, I'm just telling you what I have done in my conversations with folks that have called me. And it seems like every weekend I'll get a call on my cell phone about a restaurant or a related business that has had an employee that has tested positive. And a couple of instances where I've had those calls, they tell me about the cleaning that they're having. I have suggested to them that their employees wear masks. And the reason, you know, if you have several people that are behind the counter that are working, it is very hard to practice social distancing as they're waiting on customers. So I encourage that. I also have asked Patrick Key over Environmental Services to send one of his folks out to give people advice regarding that when I know that there's been a positive in restaurants. And actually people have been welcoming of that consultation that our folks give them.
This has a lot to do with the availability of types of sanitizers. This individual wrote, we're using our personal products to wipe down doors and clean common areas, such as the copier, microwaves, and so forth. We would like to know, can wipes or some type of sanitizer be provided for the common areas?
So what should happen is that there's a sanitation company or janitorial service that should come in 3 times a day and wipe down the doors and the common areas and counters and things like that. You should see them. If you don't, please let me know. Also, but I don't think that they're cleaning out the microwave. So if that's something that needs to happen, I think that would be something that someone on the floor would probably do. But they should be wiping off all of the common area. And you should see them come in 3 times a day. Actually, twice during the day and once in a week. That's exactly.
And maybe, and if you feel more comfortable with that, I mean, maybe we can just leave something, some wipes or something in the area so that people choose to do that themselves. Then that's okay too. But this is a time of high anxiety. Just going to be practical. Can I make a couple of announcements? Okay, I'm told that Mayor Turner and County Judge Hidalgo and community partners are going to make an announcement today around 11 o'clock, and that's related to them trying to help essential employees find some level of support for childcare. We know that we sent a survey out to employees within the department to get an idea of how many people needed some level of assistance with that. So hopefully that announcement would be responsive to some of the needs that surface. Valerie just talked about building sanitation and that we're looking at ensuring that, sorry, y'all, I don't talk loud enough, I have to move the microphone around. Ensuring that our buildings are clean, 3 times a day. But as I just said, we're going to look at possibly providing some material out so people can take the initiative themselves if they feel the need to do that. Again, just reemphasizing CDC's recommendation regarding wearing face coverings in public, particularly in situations where cannot, ensure social distancing.
When will telecommuting happen on a broad scale?
I'm a little bit puzzled about that question because it's been 2 weeks now where we have really maximized our telecommuting options. I don't know how to put a percentage to it, but the folks that are actually working in the offices and providing services in our facilities have drastically minimized to ensure that we have lessened employee contact with the public. When that question actually came in, I looked at Judy and at Valerie, and they were a little bit puzzled by that because when we knew that we had community transmission, we went to that next level.
Decisions will be who
What I've been told is that now your assistant directors did make decisions about who could appropriately telecommute.
That'd be for you. How should a family member sanitize dishes and utensils from a potential COVID-19 illness if they do not have an automatic dishwasher in the home?
So the best thing to do would be, if you don't have an automatic dishwasher in the home, would be to wash those dishes in the sink, ideally separately from the other dishes that the other household members are using. So sort of do it in a group or a session with hot water. And then after you put those dishes, they can air dry and that's fine. And then wash your hands again with regular hand soap and that should be appropriate.
So what you're saying, Kristen, is that this regular dishwashing detergent is sufficient.
Here's another one. I'm the caregiver to both of my sick elderly parents. I'm in the building every day and it frightens me to think that I could be exposed and carry it back to them. Even though I'm on FMLA, what are your suggestions on handling my role?
We have a process that we went through over the last week or so, where if people really felt that they had a special circumstance that where they needed to work at home or whatever, that people could actually apply to do that. And where that was appropriate, hopefully that was approved. That exact situation we talked about. So in this case, you should contact your FMLA coordinator to see whether there are some options for you.
Are supervisors notified when HHD employee gets tested?
Not unless the employee notifies their supervisor that they're going to get tested. But again, we get the results after the test has been completed. And we're getting those positive results after the test has been completed. So we're not getting notified every time everyone in the city goes to get tested. And the other tricky thing about it is we are only getting notifications of positive test results for people who live in the city of Houston. So if you work for the city of Houston, but you live up in Montgomery County, your test results are actually going to go to Montgomery County Health Department, not to the city of Houston Health Department. And so that's one of the reasons why we say, if you discover that your test is positive, please go ahead and reach out to your supervisor as well, because that coordination piece is definitely a piece of coordination, and you can speed that process up by making that direct outreach.
Since we are essential employees, will there be a possibility to have our nasal sputum tested and not just getting our temperatures checked?
I don't see us going that far yet. I don't know that that's appropriate. We're getting our temperatures checked, but at the same time, there are a couple of questions that should be answered, and that is, whether or not you're exhibiting any symptoms. The temperature is just to check to see whether or not you have a fever.
Is there an anticipation of a second wave, much like the 1918 Spanish flu?
So I think there's been a lot of conversation about that, right? So we're putting all of these social distancing factors in place, trying to limit the amount of interactions that people have with each other, so that if someone does come up positive, that the chances that the number of opportunities that it had for that to transmit to somebody else has been reduced. And so that's that whole flattening the curve piece that we're talking about. So as we come through this process, as time continues to go on, there are going to be conversations about starting to lift those restrictions. But it's not simply going to be that we get to a particular date. I'm going to pull out June 1st. We don't get to June 1st and say, hooray, we're finished with this. We've conquered coronavirus, because we still will have people in our population who won't have been infected. And that's what we want. But it means that we still have people in our population that are vulnerable or could be infected as that virus continues to circulate in lower levels. And so people in pay grades much higher than mine will be looking at, do we start to ease up on some of these restrictions? And then we'll have to monitor and see what's happening with the levels of the virus, with the number of tests that are coming back. So we may go through a little bit of, I don't want to say roller coaster, but I'm going to say roller coaster, as we, sort of ease up on restrictions. If we start to see cases going back up again, then we might have to tamp back down. And that's going to be sort of an ongoing monitoring scenario.
The mayor mentioned at a press conference applying for workers' compensation if you were quarantined. Can you further discuss this in detail in relation to the City of Houston employees?
I know the mayor said that, but I'm not so sure that that's exactly how that's happening. I think that HR and legal have to review that. Some cases that might happen exactly like you said it, but I'm not so sure the circumstances where that's going to happen. I think what he was trying to do is to convey that, where a situation occurred and it was obvious that it was work related, there would be some level of compensation. But that the details of that hadn't really been worked out. And so I just say stay tuned to see what the update on that is.
What is the total number to date, if possible, of the COVID-19 clients our HHD EPI team specifically have or have managed?
So I have a lot of different numbers in my head, so I actually don't want to pull that number off of my head. But if you go to HoustonEmergency.org, that's where we have our website and our dashboard, and it can link to the dashboard of both the cases here in Houston as well as the cases outside of Houston across the rest of Harris County.
Oh, and also this other person that submitted the hazard pay question, I just want to stand corrected in reference to that. They weren't talking about if someone's not doing anything at home. I believe they were talking about if the person was here working in that particular environment. The question about hazard pay was not if someone's not doing anything at home should get paid. It was really pertaining to the people that were working and on the response.
Did they get hazard pay?
Yes, sir.
Well, we talked about, I think on my first deal about actually coming up with some way to reward people that were involved in this response. I gave you a number of scenarios where people are continuing to work, and that's going to have to be reviewed by our folks downtown.
And also, another follow-up question to the masks, are they going to be provided every day on the way into work, or is that just sporadic?
It's my intention to do that up to a certain point. I have to tell you that we only have a limited number of masks. I gave everybody a mask every day. It would only last, maybe a month or so.
This next question pertains to this person understands about the importance of HIPAA and not disclosing a person's health information, including employees. However, it feels like our own health department leaders in the community are keeping certain information, limited about where people have tested positive. I believe this gives a stigma to a virus much like HIV, and no one wants to disclose their status if this continues, possibly exposing and infecting others as a result. What can you and what can we do about this?
Well, we talked about looking at a map. The thing about this is that testing is not universal. And what that means is that we're not like testing like flu for flu. And so if I look at a map and I say people in the Northeast, we see more numbers in the Northeast than in the Southeast or Southwest or whatever. That's only related to the number of people that have been tested in that area. I mean, I don't know that it's meaningful enough just because, of the limited amount of tests that have been given. People are really self-selected to get tested. So I don't see anybody hiding numbers. Actually, you should be in some of the conversations with Emeritus wanting more and more detail about this. Nobody's hiding anything. It's just that this information, a lot of information is very difficult to get. Our system is just not set up ideally so that we would have not only information, but just in time information so that our response could be more focused.
When will we find out about the interest in childcare, especially for employees who do not have childcare and obligated to come into work?
Well, I'm told that they'll get an announcement in a couple of minutes, and we'll ask our HR people to really look at what's available and communicate that information to you as soon as we get it.
Who makes the request to have the employee's workspace have the extra cleaning?
You can go.
And also, is it 3 times a day for every location or just at stadium?
It should be 3 times a day at every location, twice during the day and once in the evening. And if you find that is not happening, either let me know or Claudette Manning know so that we can work with the janitorial service to make those things occur. So we know that we've heard instances where it hasn't occurred. We're very interested in that. We want to try to make it occur. So I think the original question was how do we trigger the porters and the janitorial service to do the special cleaning if there's a particular area which there has been an identified positive. We are notified through the incident command center that this particular area needs to be shut down for 24 hours, and then we'll notify the janitorial service to come in and do a special type of sanitation and cleaning for that area. Kind of off topic, of the cleaning, I wanted to mention there's been a lot of questions about keeping information, specific information about a particular employee, a group of employees, not sharing that so that everyone could feel that they're informed. And certainly we want you to feel informed. But I have to point out that confidentiality about someone's medical information or health information is not just a right, it's the law. Many of you are aware of the HIPAA laws. They've been around for a very long time. So keeping information confidential is something that we're required to do. And we do try to give the information that is appropriate and that we can share legally.
And this one last question, Valerie, this may be for you. Is there any possible way to circulate fresh air into the health department buildings?
I'll answer that. You know, folks, the reality is that our buildings are not in the best of positions. We had actually planned to replace stadium back during the Bill White administration until the economy took a downfall, and there's just not enough resources to do that. Our folks and, you know, Claudette and her folks and our general services have really been trying to maximize, you know, the freshness of the air and the efficiency of the systems. I will openly admit that it's not exactly what it is. It just isn't. Quite frankly, I shouldn't say this because I know all y'all get all up in arms. A lot of people told me this. I think that there are certain facilities, not only in the health department that are in the city overall, where I go in and I have a reaction. And I think that's more of an environmental deal. But from the scientific standpoint, I haven't really proved that. But that's just my thought. And I know a lot of y'all think that too.
Well, I would like to thank everybody for being here on this live stream. We're getting ready to wrap it up. Stephen, is there anything else you would like to say in closing out comments?
No, I have to continue to say that I'm proud of the work that we're doing in response to this COVID-19. I had a colleague talking to me this morning and said, Stephen, you know, we've had storms, we've had floods, and a number of other situations that have occurred. But I have to tell you that what y'all in the health department are confronting here is a lot worse than anything that we face in the length of time that I've been here for the city. What we're fighting is something that you can't see. You certainly can feel the impact of. You know, with floods, with hurricanes, we are talking about a minimum level of loss of life, but really things that are impacting property. Here we're talking about life, and that's really what we're doing. We're talking about saving lives, and that is really what I want you to keep in the forefront of your mind, is that all of the work that we're doing, all of the extra hours that we're having to put in is about saving lives. I look at the chat that goes on between the health department directors across Texas, and they're facing the same battles, the same challenges. Y'all, we're in this for the long haul. I think you can expect to see the numbers continue to increase. I think that you can expect to see the number of challenges associated with residential living facilities such as nursing homes, rehab facilities, or whatever. We will do whatever we can in order to, you know, coach and consult with them. But remember, there are a lot of people that finish marathons, and I think this is a marathon that we, as the staff of the Houston Health Department, can finish and still be standing